When children and families come to the hospital, they start at the admitting area where they do the paperwork. Then they come up to the surgery area, and there is a whole team of people who are ready to take care of them.
Hi, how are you?
Good. We have an appointment for surgery. His name is Alex Jones.
Hi, Alex. Yes, my name is Susie. How are you?
Good.
You okay? Okay, Alex, I just have an ID band for you to put on. It's for your safety, okay?
It starts with the receptionist who puts a band on the child, and so that way we know who that person is, and we continuously check that band throughout the day to make sure that we have the proper patient and the proper procedure, so those match up. Then the child is going to see the patient liaison.
If you have any questions, issues, worries, concerns, anything that might be, I want you to please feel free and contact me. Do you have any questions at this point?
I'm curious about how long the procedure is.
That takes about an hour and 15 minutes. And
The
that's
patient liaison's role is to check in and see how the family is doing, and that person often goes back and forth during the procedure, so if there are updates that need to be given to the parent, the doctor stays where they are, and the liaison will come out and let the family know how the surgery is going. Hi, you must be Alex and Mrs. Jones. I'm Tony. I'm the child life specialist. Hi, nice to see you, Alex.
Hi, nice to meet you.
Nice to meet you as well. Well, what we do is we help explain how things are going to happen for you so that there aren't any surprises. Birthday parties make good surprises, but not doctor stuff. Then they're going to see the nurse who takes care of them and gets them settled. The nurse will start out by taking their height and weight, which helps us know exactly what their body mass is so we know how much medicine to give them.
So, has Alex ever had any procedure before, any anesthesia for any reason?
No.
And today he's having an inguinal hernia repair?
Yes.
Okay. So for this procedure, we give him general anesthesia. That means he's completely asleep throughout the entire procedure. He doesn't feel anything. He doesn't remember anything. Okay?
Throughout the day, then they will see a variety of physicians. The anesthesiologist will talk with them.
Do you have any questions, Alex?
Why don't I get to eat?
Because if there's food in your stomach when you go to sleep, you could actually throw up while you're going to sleep, and that'd be dangerous for you. So we just
so
make
is
sure
it
that your
because of the
stomach is...
surgery?
Exactly. It's because we want you to go to sleep very safely.
Oftentimes, too, they'll have a couple residents with them, so sometimes they come with a few people. And then the doctor who will be doing the surgery will stop by and have the parent sign the consent form.
So Alex, I wanted to go over everything we're going to do today before your surgery. Is that okay? Mm-hmm. All right. I just want to make sure you haven't had anything to eat or drink this morning. Did you have a big breakfast?
No, I didn't
No?
really have breakfast.
Awesome. Okay, because we want you to have an empty stomach before to make your anesthetic safe.
They actually take a little pen and they mark the site, and they compare that to also the band on the child so that we're making sure that we have the right patient and the right procedure.
So Alex, one of the nurses is going to come and get you and bring you back into the operating room. And then you'll lay on a table very much like this, and you'll see the anesthesiologist that you spoke with earlier today.
Okay, first we're going to let Mom smell the mask. Smell good, Mom?
Sherry.
Yeah, okay. How about you, Alex? What do you think it smells like?
Good.
Smells good, right? Okay.
And so after you're off to sleep, we'll do the operation, and at the end you'll wake up and go to the recovery room, which is right across the hall. As soon as he wakes up, we're going to try and get you into the recovery room to be with him right away.
Okay.
So you're separated for as little time as possible. Then he'll just spend some time in there recovering from the anesthesia. He'll have some juice and some crackers. And when we're happy that his pain is well controlled and everything looks good, then you can go home.
Okay.
Okay?
Great.
And then we'll talk about the wound care and his activities and going back to school and all that stuff in the recovery room.
It's really helpful for parents and children to know that they should ask any question that's on their mind, that we really want them to understand the full experience. And it's also really important for parents to understand that their children need to know what's going on, and they need to be able to answer their child honestly.